Dr. Chris.
Sally, thanks for having me.
I'm glad you could be here. We're going to talk all about Convergence Medical in a moment. And I'm not going to give the cat out of the bag and talk about what that is. Everybody has looked in their newspaper, but you're going to tell us the story. But the thing about you that's so fascinating, and I just confessed, I had to go, when I looked at your story and I heard your background, I had to go onto your LinkedIn and then look at that and then look at the dates and just went, I can't believe he's actually done all of this in the time that he's been alive, because you've got 2 successful exits and you've crammed a hell of a lot in. Why the heck are you doing it again? And how did you get to the point that you're doing it again as a serial founder? And what are you doing? That's a lot of questions. That's all the questions. Now I'm just going to sit back and relax.
Where do we begin? Yeah, so why would I do it again? I'm a bad employee and retirement didn't stick. No, but I love innovating, so I love problem solving. I describe myself as a tinkerer of all kinds of things. I can see there's some friends and family. By that I mean consultants and employees in the room, and friends, I believe. Let's say that. They tell me that. And, you know, it's a vibe. It's a good journey. There's nothing better than making something that matters and taking it from, you know, that idea, that napkin, that conviction, bringing something into the world, and then seeing it really change an industry. It's what gets me tick. I couldn't stay back. Better than golf. So
what inspired you to start Convergence, and what was that journey to get to this point now? Because this is
Sure.
third one.
Yeah, so I think the journey to the point is probably the easiest way to start. So a little bit of serenade with the room. So I grew up in Stradbroke Island as well, so a bit of a mutual thing.
Queenslanders represent.
That's right.
Just
that's
saying.
right. My family, I was the first to go to graduate high school. I initially did engineering because I thought Ironman was cool, and they gave pizza for the open day. I went on a rugby league scholarship because, you know, that's what you do when you grow up in Stradbroke and then go to Wynnum. And that was really hard to hold and go to uni and maintain a GPA of 6. So I transitioned over to a military scholarship, and that set me on my course. So after doing engineering, robotics-focused engineering, I went off and became an army officer, and I was very young and diligent. So the army rewards you when you're diligent by sending you on deployment. So I did 1 tour in Iraq, and then I followed into Afghanistan. And I spent that time taking care of I was the adjutant, so second in command, taking care of those that weren't so wary, which were our doctors. So I was there for 9 months. This was before Netflix, so I had scrubs in house, and I was hanging out with doctors all day. So I came back, decided I wanted to go to med school. Then what do you know, right place, right time. I think that's what we said makes deep tech. It's also what makes a career. That's where Queensland Health had its payroll scandal. And everything got a bit turbulent. So Queensland at that time, when I was studying to become a doctor, they decided to launch an MBA in healthcare. And to do that, they picked 5 people with unique backgrounds. And I guess I was already accumulating some runs on the board by then to do the business, to learn MBAs in the business of medicine. And from there, graduated through and went off to be a doctor. Let's go to the businesses. Sorry, Sal. So then as we become doctors, we have to do a little bit of everything to understand what we were going to do. And one of my first gigs was working in ENT. I was doing ear, nose and throat surgery. We had a pediatric clinic. So I had little kids, 2 to 5 years of age, that were missing developmental milestones, and that either means that they've got a hearing problem, often an infected ear, 80%, or something really scary like a brain tumour or so on. So before you irradiate their brain, you really want to know if it's the hearing, but we didn't have enough audiologists, tertiary trained professionals that can do the can you hear the beep test. So I was very frustrated. I'm a tinkerer, as I said. So I went home one day, I pulled out my old VHDL coding textbook, and I rewrote the firmware of the Qualcomm Bluetooth pack. And I made these headphones. As you do. And I made these headphones that could learn how you hear and give you an autonomous audiogram. However, that was a medical device company, and I was a child. I was 22 at this age. And that's a big, audacious goal for a first-time founder. Fortunately, that was 2014, and people were talking about headphones. Drake had just sold Beats to whoever he sold it to. And I was like, and shout out to Clandestine Design, who came into this story right at this chapter. But I was like, you know what? headphones really haven't been differentiated for a long time, so why don't we make headphones that learn how you hear, make personalised sound? We can grow that as a business and use those funds to really change healthcare. So we went on and made Audeara, which became a publicly listed company. We listed here on the ASX, and that chipped off the story. By then, I was training in orthopaedics. Friend, mentors, colleagues and peers were asking why I was innovating in hearing stuff when I really care about bone surgery. We call it real surgery. Some other doctors in the room, and they also have real surgeries, but us gorillas, we love the bones. So they backed me in to start my second venture, which was we have a lot of issues when it comes to orthopaedics. In the industry we're working in now, over 40% of the time there's a big bag complication. It's pretty bad. You flip a coin, you can almost get better odds than to get an operation by a doctor until you get our robot. But so they've backed us in $2.2 million, and 6 months later we had a commercial target. We spent the next 7 years redefining hand surgery. Shout out to the Australian team. Half of them have our implants in their bodies, and they've won gold because of that. Anyway,
amazing.
We're diverse, but
Olympics,
that's how I got in.
That's how I heard it was Olympics claim there on the seat. So
there we go in, right? Yeah. So 7 years later, 40 countries around the world, 2,000 products.
Amazing.
That's how I got onto this venture, and then we can talk on today. But I've spoken.
So VO1 surgical robot. What are you doing? What's unique? And what does everyone need to know about it?
Yeah, so after that chapter, we exited that business off to a commercial conglomerate, and like I said, retirement didn't stick. So I wanted to really do something that mattered, and the biggest problem in my world, being orthopedics, is how do we do minimally invasive surgery without being invasive or without making complications. As I mentioned, 50 million patients every year get these arthroscopic procedures, so ACL procedures, rotator cuff procedures. Every sports player or team you follow has had one, but we're really bad. We don't have enough hands. We get distracted because of the manual instruments and make mistakes, and really we just lack the precision to get the job done. So the VO1 robot, which we developed in 2022, got breakthrough status from the FDA in 2003. It makes us better, so 30 times more precise, 4 times faster, and it can do all that without changing the total cost of care. Really, there's so much more. We've got 2 minutes left.
I know. So I'm gonna jump into it.
Sure.
So you said 2003. That was then just
the breakthrough designation.
The breakthrough designation.
Yeah.
Where are you now? Where are you going?
Yeah.
What do you need?
So they're
the 3 main questions, I think.
Yeah. So going from 2023, we did obviously a seed round. We closed some Australian US investments, so that allowed us to launch through and go through to the end of our clinical execution, which ends at December this year. From there, we signed up our first 30 surgeons, which takes us through to our 2027 targets. So we're ahead of schedule, and our first 5 hospitals, which are ready to take their robots that are arriving in November 2025. We were launched at JP Morgan Health this year. Thank you, Beta, for helping us cross those borders. We opened our US office in San Francisco, which has our clinical and commercial focus. So what we need now, we've got our round A open. We're raising 10 mil currently, and that's our go-to-market round. Anyone interested in surgical robotics, orthopedics, medical health, or a third-time founder trying to give it a go, come see us and we'll show you more.
Third-time founder trying to give it a go. sounds like a little bit more giving it. You've done a bit more than just give it a go. You're quite progressed through it. If there's one thing that you think everybody needs to share with somebody else out in this room, everybody's going to end up. By the way, if you haven't had a surgery yet, you're probably going to need one at some point. Not just speaking to the runners in the room, but all of us at some point. What is it? What's the one 50. Thing that everyone needs to know to be able to come and follow up in a conversation with you on the booth?
Yeah, sure. I mean, everyone has a connection, whether it's a first or a second degree, but medicine is a small place, and we all either directly know someone who's in orthopedics or medicine, or we've been treated by someone in orthopedics and medicine. Whether they're a future customer, a supporter, or a financier, they can all help us on our journey, right? And we'll go it together. That's really all it is. Surgery has a long way to go. We're still today, unless you're lucky enough to get the robot, we're dealing with 50-year-old technology to try to do what you think is the most important operation in your life. So let's try to get this a little bit down the line so you're not on the bench and putting your limb on the line next time you get an operation. Hey?
Awesome.
Yeah.
Well, thank you so much, Chris. We are very excited to hear about what's next and really looking forward to seeing the outcomes of those first patients
Sally,
being
you
treated.
ready?
Oh yeah, hey. And we got to do that for the social.
We knew that was going to happen. Yeah,
awesome.
yeah.
Give you a big
Thanks,
round of
team.
applause. Thank you very much.